Hi. Some of the causes of hypertension are due to renal or hormonal abnormalities, but these make up only about 5 to 10% of all the cases of hypertension. In all other cases, the diagnosis of exclusion is primary or essential hypertension. Apart from a genetic component, more women than men are affected by primary hypertension. In addition, chronic psychological stress, be it job-related or personality-based, can induce hypertension. This causes an increase in cardiac stimulation and hence increases cardiac output, which eventually leads to hypertension or high blood pressure. Excessive salt intake increases systemic sodium, and with a reduced systemic potassium, this increases extracellular volume, and that goes on to elevate the cardiac output. In addition, the concentration of calcium in the cells of the vascular smooth muscles is increased. This induces vasoconstriction, which works together with autoregulation as a result of elevated cardiac output to cause hypertrophy of the vascular smooth muscle. Hypertrophy of vascular smooth muscle invariably increases total peripheral resistance. Primary or essential hypertension makes up about 90% of all cases. The various forms of secondary hypertension makes up only 5 to 10% of all hypertension cases. However, contrary to primary hypertension, their cause can usually be treated. Because of the late consequences of hypertension, such treatment must be initiated as early as possible. Renal hypertension, which is the most common form of secondary hypertension, can have the following causes. Renal ischemia, for example, may result from aortic coarctation, renal artery stenosis, as well as narrowing of the renal arterioles and capillaries, as in the case of glomerulonephritis and hypertension-induced atherosclerosis. This ischemic state leads to release of renin in the kidneys. Renin splits the decapeptide angiotensin 1 from angiotensinogen in the plasma. Angiotensin converting enzyme, popularly known as the ACE enzyme, which is highly concentrated especially in the lungs, removes 2 amino acids from angiotensin 1 in order to form angiotensin 2. Now, angiotensin 2 has a strong vasoconstrictor action and therefore increases total peripheral resistance. Also, aldosterone is released from the adrenal cortex in order to induce sodium retention, and this increases extracellular volume. Eventually, cardiac output is elevated and blood pressure is increased. In kidney disease, with a significant reduction of functional renal mass, sodium retention can therefore occur even during normal sodium supply. Apart from renal hypertension, other forms of hypertension make up about 3% of all cases. In adrenogenital syndrome, cortisol formation in the adrenal cortex is blocked, and thus adrenocorticotropic hormone or ACTH release is not inhibited. As a result, excessive amounts of mineralocorticoid active precursors of cortisol and aldosterone, for example 11-deoxycorticosterone, abbreviated as DOC, are produced and released. This leads to sodium retention and therefore an increase in extracellular volume, and this causes elevated cardiac output, leading to hyperdynamic hypertension, where the systolic blood pressure increases more than the diastolic blood pressure. Now, primary hyperaldosteronism, also known as Conn's syndrome, is another cause of secondary hypertension. In this condition, an adrenal cortical tumor releases larger amounts of aldosterone without regulation. Also, in this case, sodium retention in the kidney leads to cardiac output and hypertension, also known as hyperdynamic hypertension. In Cushing's syndrome, an autonomous adrenal cortical tumor increases plasma glucocorticoid concentration. This results in a raised catecholamine effect of increased cardiac output, as well as high levels of cortisol and sodium retention, which leads to hypertension. Pheochromocytoma is an adrenomedullary tumor that produces catecholamines. This results in uncontrolled high epinephrine or adrenaline and norepinephrine levels, and therefore elevated total peripheral resistance, as well as cardiac output, leading to hypertension. Contraceptive pills can cause sodium retention and therefore is very capable of causing hyperdynamic hypertension or cardiac output hypertension. In the case of neurogenic hypertension, encephalitis, cerebral edemas, or hemorrhage, and brain tumors may lead to a massive rise in blood pressure via the central nervous stimulation of sympathetic nervous system. An abnormal high central stimulation of cardiac action as part of the hyperkinetic heart syndrome may also cause hypertension. Thanks for watching. Please like this video and subscribe to this channel. More videos coming up. See you in the next one.